Hello, this is Dr. Mike Cassandra, and I'm here to talk to you about type 2 diabetic patients on oral therapy who are not well controlled. Just one idea for you is to get those patients to get motivated to get better glycemic control by teaching them about themselves, have them learn more about their diabetes. And they can do this by checking their blood sugars more frequently. Very simple, but a lot of patients are hesitant to do that. But not if you negotiate a time frame, and negotiate a goal, and negotiate a solution. So the time frame would be a brief time frame at first. Pick, let's say, 2 weeks. I think 2 weeks is a very realistic time frame for them to check their blood sugars 3 times a day before meals. In this 2-week period, they should also try to keep a very brief journal. Do not give them too much to do or else they won't do it. Have them please check your blood sugars in a 2-week time frame 3 to 4 times a day, prefer 4 times a day, and write down what you eat, what you do, what time you go to bed, what type of exercise, what type of activities you're doing, etc. Then have the patient come back soon after doing this to the office and speak to them in detail about what they're doing and what their blood sugars are. And this could be very revealing for you and for the patient. This is actually a big motivator for the patients because it shows that you are very interested in the details and that you're willing to listen to them. And also they may actually wake up and realize that they should have been listening to you. So it's very rewarding when patients get this information. Also consider putting them on a correction scale insulin, explaining to them that this is your spare tire, this is your emergency, this is your backup. If you have a correction slide scale insulin, you can actually do something about your high blood sugars. And a very simple slide scale started at 150 with a correction factor of 50. So they take 1 unit for every 50 points above 150. That's a very light slide scale. You may realize later that maybe you need a more aggressive slide scale, but this is just a teaching exercise, an exercise about the patient learning about themselves. Again, come back after a mutually agreed upon time frame for them to come back 4 weeks, 6 weeks, or less, and see how they're doing, how much insulin they're taking, what they're learning about their blood sugars. This is very instructive for both the doctor and the patient. Also consider a 14-day in-office continuous glucose monitor. We do that in our office all the time because we have office-based diagnostic CGMs that we obtain from Freestyle and from Dexcom. Now, these have to be obtained on your own because you cannot refer to another office to read them for you. So unfortunately, you do have to obtain one for your own, but consider investing in this. It is so rewarding to see it graphically what's going on with the patient. And the patients that will qualify for a CGM would be patients whose hemoglobin A1C does not fit their blood sugar average, or they are having unexpected hypoglycemias or unexpected hyperglycemias, a lot of fluctuations, anything that frustrates you about the blood sugar control can be explained in the note and used as a reason to get a CGM. The main thing would be that the hemoglobin A1C does not match the blood sugars that the patient's checking with their finger stick, okay? Then, of course, consider the personal continuous glucose monitors, which are getting easier to obtain. Of course, currently, there are very, very few insurance companies that would approve a continuous glucose monitor for a patient who's not taking insulin. I would say it's a very small minority of private insurance companies that would actually allow that. But if you motivate a patient who's not well controlled to start checking their finger sticks 3 times a day or more, 4 times a day actually to qualify for that, and they start seeing that they need to do the slide scale insulin, and so you teach them how to do this and they start doing it, and it becomes more than just the brief time frame you gave them. It becomes more involved and they see the value in doing it and they can be motivated to do it. Then those patients would actually qualify for a personal continuous glucose monitor. And that is so rewarding. Patients learn so much about their blood sugars, so much about their dietary habits, so much about what makes their blood sugars go up and what what activities and what kind of diet makes their blood sugar better controlled, it's really a great tool. So please consider these things when you're managing those difficult to treat type 2 diabetics who are not yet on insulin. Okay, thank you so much. This is Mike DeSandrin.